So much for being part of this. We have hundreds of you on. If you could go ahead and do me a favor and tell me that you can see me, you can hear my voice. I'll put up the slides in just a minute. And just to make sure that everything is working well, put it in the chat. Tell me that you can see me. Tell me that you can hear me. And I'm going to get everything started here. All right. I am going to share my slides. It is so good to have all of you here. And so let us see if this will work here. And now you should be able to go ahead and see my slides as well. So tell me who you are, where you're from, what kind of healthcare professional you are. Put it in the chat. Tell me that you can see my slides. You can see me. You can hear me. And then we should be good to go because we have got so many of you. First one is Tracy, an NP from South Carolina, and I knew they would be coming too fast. Judith, who's a dentist I didn't see where from, and Leslie, who's an NP, and they're coming too fast. And Andrea, who's a dentist from Florida, and Tina from New Jersey, and Pauline from who's an NP from somewhere, and Brianna, who's a nurse from Wichita, Kansas, Todd, who's a dentist in New York. You get the idea. We have got Peter, who's an MD from Missouri. We have got everybody. It is so good to have you here. Literally, this is going to be pretty much go to capacity in just a couple of minutes. So I am glad that you are here. I'm not going to get to all of you, but welcome to all of you. I want to get into this topic. Here are the rules of the game here. Go ahead and feel free to ask questions as we go through this. I'll probably stop at certain times to take questions. On your end, I'm going to show a lot of video. I'm going to show you 4 different uses and kinds of dermal fillers almost, and we're going to do some amazing things for patients. So again, we'll stop for questions at certain points, and let's take it away. Anything on your side that you can do to kick people off in your house, the streaming or backup programs that might be running. We're going to show a lot of video. I want you to have a really, really good a good experience here. And let's get into it. My name is Dr. Louis Maltzmacher. I'm president of the American Academy of Facial Aesthetics. There's my email. I put it out there all the time. There's the AAFE, the American Academy of Facial Aesthetics email. Here's a good resource slide. So if you want to take a picture of it, if you haven't been around here, or we've got some new websites that we're going to point you to, and we're going to talk about some of these as we go through this program. So this is a really good resource slide for you in general for that. So I'll just keep it up for another minute. But if you have any questions afterwards, we're here to help you. Me and the entire team at the American Academy of Facial Aesthetics is here to really help you. Please follow us on all your different social media channels where we post clinical content nearly every single day. So if you want to see it, you want to see it. And definitely go ahead and subscribe to us on YouTube as we near 100,000 followers. But more than that, we've got millions of views, and we have got in detail a lot of resources on that YouTube and all of these channels there as well. We are a live patient CME certification injection training, almost university. It's definitely university level. No one's got the curriculum that we have. AAFEspecial.com. They always give a training, a webinar training special. So you can find it at AAFE training, AAFEspecial.com. Whether it's level 1 Botox and fillers, foundational, level 2 advanced, level 3 master, a lot of different master courses we have, cadaver lab, ultrasound training, PRP, PRF. We've got online certification trainings for some of this. A really amazing array. You're going to see parts of this as we go through it. Frontline TMJ, oral facial pain, which amazingly we started a long time ago just for dentists, but everybody's taking that course because as big as aesthetics is, pain management is even bigger in the head and neck, and it covers migraines, headaches, TMJ, all those different things. Trigger point training with neurotoxin, with Botox for that. But that's who we are, and I would urge you, for the sake of your professional license, because every single medical, dental, and nursing board knows the AAFE, is you've got to, this is a real discipline, just like any other part of medicine, dentistry, or nursing, to take real CME courses for that. Like I said, everybody literally knows the AAFE curriculum, all the licensing boards. We answer questions from them literally every single day. Just today, across the board, I was dealing with 5 different licensing boards who had questions about cases and whatnot for all of that. So that's who we are, and this is who we are. We are our faculty. We have got the best faculty in the world. You know why? Because they are all practitioners just like you. They've all come up through the AAFE system, and so they're all AAFE trained. They know our philosophy, of which you're going to see in this program. You're seeing an entire array of physicians, dentists, nurses, nurse practitioners, PAs, optometrists who can inject Botox in certain states, dental hygienists who can inject Botox in certain states, estheticians, medical assistants, you name it, they are all here. These are the greatest people in the world. I mean, we don't have prima donnas in the AAFE. They are real people, and that's who you want to really learn from for that. And we have the highest ratio of instructors to attendees, which is important. We give courses all around the country. AAFEspecial.com. They've got 12 packages available till midnight tonight. You see where we are at. The stars are AAFE training centers, where we give most of our courses every single month, and we're in all these other cities constantly, at least quarterly and usually more often than that. Here is the special if you want to go ahead and take a picture of it or go to that QR code they are doing for the first time ever an over 30% off deal, summer deal, I don't know, whatever they call it here. And it includes injectable product for uses at the course. Again, different. The gold package includes a whole med spa and aesthetic business on-demand training. You get to go ahead and add on, if you want, for literally just almost pennies, these online certification courses that are listed on the right side of your screen. One for $199, and they sell from anywhere from $797 to $997, and add another one on for that for an extra $100. That's a lot of CE, but more important than the CE, these are real skills that you should be getting. So it's either 4 courses, 3 courses, 2 courses, whatever you want. They all come with AAFE membership, which means they all come with the AAFE membership forums, of which there's incredible resources. We're a very nurturing community, and that's what you need, whether you're getting into this or you're already into this. Who do you ask questions to? I will tell you that many of the other places that go ahead and train on injectables will train you and then really are not that interested in hearing from you again. We are going to drag you by the nose, literally, to be successful, which is why AAFE members are so successful for that. But these are the biggest savings that the AAFE has ever had. And with this webinar bonus of the add-ons and everything you see and a lot more. So AAFEspecial.com, go there. Usually we will get a lot of training questions, which I'm happy to answer at the end. But I can tell you that most of what you have is going to be at AAFEspecial.com or on the website. So if you want it, go ahead and grab it. You can use these courses now. You can use them a year from now, 2 years from now. You can lock this in before tuition goes up. But this is among the lowest tuition they have ever offered with all of these bonuses, which is really pretty incredible for that. So if you want it, go ahead and go get it. Let's get into this. Why do we love injectables? Because it's a dream practice, and you get paid what you are really worth. Again, whether you are a physician, dentist, nurse practitioner, PA, a dental hygienist, doesn't matter what the letters are after your name, you can be the best injector. It's going to take training. It's going to take some experience. It's going to take someone you can ask questions to, and mentoring, which again, in the AAFE, we do for free for AAFE members when you get any of those packages for that. Aesthetics really is the great equalizer. It doesn't matter if you are a plastic surgeon or you are a nurse practitioner or you're a nurse or you're a dentist or you're any kind of physician. It doesn't matter. You can be the best injector. And that's exactly what we turn out in the AAFE. There's no capital investment, no huge inventory. You are literally investing in yourself. And by the way, patients are investing in themselves. You should be doing the same, and you'll have these skills for the rest of your career. It's a very dynamic, a practice, by the way, because there's always something new. AAFE members in 2025 are up 35 to 45%. So again, whether you're just starting, you want to add this on to an existing practice, which is huge because you already have a patient base, you want to start a new practice or an aesthetic practice, we are here to really help you. And you've been thinking about doing this for a long time. do it already. I mean, literally do it. We can show you thousands of AAFE members who are successful with this. Again, there are all kinds of healthcare professionals for that. And if you already do it, it's time to kick it up a notch and get more training. So it's, stop waiting around for this. I mean, just imagine, and I'm going to show you more. I'm going to show you the impact on your practice, what kind of dollars that are profitable when it comes to all this. We'll get into all that for a long time, but it's really about investing in yourself. And we are here to really help you go ahead and do that right now, because like I said, patients are investing in in themselves, no matter what the economy is. And by the way, everyone's going, I don't know, the economy's not so good now. I don't know. Look at look at the stock market. It's booming. The economy is maybe a lot better than you are, and this is aesthetic investment, spending more despite economic strain. We're investing more in ourselves than ever. And that is exactly the point. And that patients are investing in themselves, you should be too. These are the services that they want. So the introduction to dermal fillers is really all about facial aging or preventing facial aging. And if you want to know how you're going to age, just go ahead and look at your mother or your father, because that's pretty much what you're going to look like. Now, you may take better care of your skin and you may have different habits than that, but you got the same genes, by the way, and this is 3 generations, and you can certainly see the difference, especially between the mother in the middle and the grandmother on the side. What happens when you lose collagen and fat in your face? Things start to drop, or they don't necessarily have to, because if you can maintain, and this is why these things are so popular, if you can maintain, then you can look better at 55 than you did at 29. Not just try to look young. You could look younger, and literally you can look a lot better. And again, we can certainly show you many cases. We're going to show you a lot of cases as we get into this. Anatomy, safety, and technique. This is what the AAFE is literally built on. And if you want to be a great injector and really learn it, you've got to know the anatomy, safety, and technique. And in terms of fillers, and we'll show you a little Botox too, but in terms of fillers, we're going to show you what that means, and we're going to carefully show you our technique. And again, 4 different kinds of fillers or applications of fillers that we are really going to get into. But this is the basis. If you don't know anatomy, if you don't know safety, and especially if you don't know technique based on anatomy and safety, then you will not be a good injector. And by the way, there are a lot of bad injectors out there, whether they are not really committed. I mean, we see it all the time. People learn it on YouTube, and it's a disaster, or they don't really get trained comprehensively enough. That's really what we build the AAFE on, the fact that you will be the best trained, even on level 1, which is like the bread and butter filler things, but then really going ahead and figuring out everything else. When it comes to anatomy, and this is, I could go for 3 hours on anatomy. In the AAFE, we are anatomy crazy. So again, you will have a very good basis of anatomy if you're AAFE trained. Many of you are AAFE trained, so you know exactly what I'm talking about. But when it comes to fillers, because you're going to see what we're going to be using as a filler, it's a jelly, basically. So where you're putting this jelly, you better know where the arteries and the veins are, by the way. It's not just about the arteries. You better know where the arteries are, because you don't want to get that filler into an artery. You don't want to put too much filler on top of an artery and compress it, because everyone needs good blood flow. Now, again, this is a rare event if you know the anatomy, you know safety and technique, and if something bad happens, then you know how to take care of it. I mean, again, it's pretty rare when you've been really well trained that something bad will happen there. I mean, we've got 5 nurses that inject with me and under me every single day of the week, and they're also AAFE training faculty members as well, so they teach a lot too. But I mean, we see hundreds of patients, right? Thousands of patients over the course of a year. The adverse complications are very rare. I mean, it's a fraction. It's literally in the single digits or less for that, but you got to know what to do. So it's really important. That's all knowing the anatomy. We want to stay away from these arteries, so we got to know where they are. we have to either be above them or be below them, and know when there is a problem for that as well. That's all in our training for that. And again, this is also about really knowing facial anatomy, not just where the arteries and veins are, but also where the muscles are, the different facial planes, and all of that. It can seem, if you've never done this before, overwhelming, but it's really not. Because whether you are a physician, dentist, nurse practitioner, PA, again, dental hygienist, or any other healthcare professional, this is your first few courses that you had in any of those medical, dental, nursing school that you've been at for there. So it's in your brain. You know a lot of this already. We just got to pull it out and show you how to really apply it when it comes to injectable training. And that's why we always push people to take, especially after you take a level 1, even after a level 1, but certainly if you've never taken a cadaver training course where some of these slides and the graphics come from, you've got to take a cadaver training course after you've gotten trained at least in the foundational skills for all of that, because then you'll really understand facial planes and all the, and there's nothing like actually working on a cadaver. This is unlike any other cadaver training course in aesthetics, because it also includes ultrasound. You get to inject, you get to dissect, and they're pre-dissections too, but you really will understand anatomy, because it's really all about the anatomy, whether it's neurotoxin, whether it's filler, but it's also understanding the properties of a filler. So I'm going to show you what a filler does in a 30-second video that really will tell you a lot of what a volumizing filler does. So here we go. Here is a perfect way to see how fillers work. And just take a very dried tomato, not completely dried, and put some filler in. This could be any filler, and you add volume, and you're going to see it expand. And what you're also going to see is something fascinating, is there's a certain point when the tissue just can't take any more filler, and then it starts to express out. That's an important point. Keep that in mind. You can expand tissue and add more filler later, but this is a great little demonstration on how filler works. And again, what I love about that is, remember this one thing. If you learn nothing else, okay, in this training, remember one thing. Tissue can only take so much filler. When people get really overfilled, that filler's got to go somewhere. So if you really want to minimize your complications when it comes to filler, again, it's knowing the anatomy, number one, but number two, you are injecting. What you see is what you get. When you try to overfill and the tissue can't hold it anymore, then it's going to go somewhere where you don't want it to go. Now, many times, lips is a good example for someone that has very thin lips, and we're going to show you a lip case. Someone that has thin lips, it can only take so much filler. So we can fill it in one appointment, then wait 3 to 4 weeks, and this is true of cheeks, it's true of anything else that we fill. Wait, let the tissue expand, because it is soft tissue. Then we can always go back and add more if we need it at that point for that. So remember that. We're dealing with soft tissue that can be expanded, but it can only take so much at any given time. Otherwise, you're going to have some kind of a complication, even if it's overfilling. And we'll show you a little bit of what complications are like for that. But that's what these dermal fillers are. They are volumizers. They are clear, colorless, hyaluronic acid gel fillers for the most part for that. They have different cross-linking. They have different rheologies. Some will last for 6 months, 12 months, 18 months. Some are firm, some are flexible. You've got to know, and there are a lot, especially on the U.S. market. By the way, some of you are international. On the international market, there are 300 fillers that are available for you. You've got to know what you are using. What's the best filler here? They're all best fillers. They're all tools in the toolbox. There is no one best filler. The question that you need to know and get trained on is, what's the best filler for what I want to accomplish? Do I need firmness? Do I need flexibility? Do I need it to move with the face? Or do I need it to go ahead and sculpt any of those things? I mean, again, certainly the Allergan fillers have always been the most popular in the world, with Voluma being number one. That's a pretty heavy duty filler, by the way, but it does the job for for big bulk filling, but we wouldn't put in lips. Some people do for that. So all the Juvederms are really workhorses. The Restylans are good fillers. I think a sleeper filler is Reviness Versa, all the way to the right. Versa and Versa Lips. Those are great fillers. They will all do the job for you. There's only one on here that is a calcium hydroxylapatite filler, Radius Plus, we use for really bulk filling. It's a kind of a different animal and something for a little bit more advanced. Well, let's show you what a filler does, and let's show you some of the AAFE technique right now on this patient. Same patient, we're going to come back and just show you her quick neurotoxin treatment too, and we'll talk about why you do neurotoxin and fillers together for the most part here on most patients here. So I'm going to turn off my camera on the webinar platform so you have a little better experience. So here we go.
Now let's do Dana's left cheek here, and we are going to go ahead pretty much repeat the process. Anterior cheek first on her because she needs it all the way across. So we're going to start on the anterior, being careful of the informal foramen, know the anatomy, keep that moving, and we are going to go ahead and deliver anywhere between 0.05 to 0.1, never more than that. Keep watching the tissue. That's super important. And that becomes the focal point for now the rest of the injections. And you've got to know exactly how to go ahead and proceed. You are touching bone and then pulling off a little bit and then going through your entire safe injection perfection protocol of slow injections. Keep the needle moving after you place the bolus here. Watch the tissue, make sure there are no changes, and know that anatomy. And again, if you're not on bone, then you are not going to get any of the support and any of the push out of that cheek enhancement. Now, we are using a heavier filler. In this case, we are using Voluma. It can last anywhere from 12 to 18 months. We usually tell patients about 12 months because everybody is a little bit different, and this is really important. So you can see nice, smooth injection, but it is going to be a heavier filler on her. The reason for that is because she lacks a lot of volume. And again, this is an important point. It's lacking volume rather than she's lost volume. And we would treat those things a little bit differently because someone that is lacking volume, like Dana here, she's got good bony support in that zygomatic process. Somebody older that's lost volume has also had some bony resorption, and that really figures into your treatment plan because they're not going to have as much bone to go ahead and give you that bottom support to push all the filler up and support the tissues to give you those nice cheeks. By the way, look at the other side where we did the cheek enhancement on her right side, and look at that curve starting to develop. It's a little bit swollen. That's okay from the fresh treatment that she literally just had, but not very swollen here. Using the right techniques, and every patient is a little bit different, and you've got to give them time. It's going to absorb some water naturally, and though all of those things together are going to go ahead and give us and turn into those perfect cheeks. So right now we like it, and after it heals up and after a few days, we're absolutely going to love it, and so is Dana here. So that is what we are looking for that. Now you see how Jill does one pass of treatment here and then is evaluating it, and just keep evaluating it. You see the patient is very comfortable because she is talking through the entire procedure to Jill, who is injecting her for this. So you can go ahead and see and watch. Again, we're going to show you a number of things that's going to happen, because this question always comes up. Do cheek enhancement fillers lift the lower face? Well, you're going to go ahead and see in some of her before and afters how it's going to cause a significant change in this patient. Not everybody gets that change. The reason it's more of a change in this patient, which most people don't think about, is because she has lack of volume. And because she's got all the bony support, that will give her or simulate a little bit of an actual lift. If we really want to lift, we go to PDO threads for all of that here. And so now you can see we're just waiting for that, taking a look at it from a 3D perspective and really plotting out where else would we need a little bit of filler, and giving the filler a little bit of time to go ahead and absorb some water, just like we did on the other side. And now we evaluate, and now we go ahead and let's tweak it a little bit. We want a little bit more here or there, and you can see by the volume in the syringe how much we were using, and certainly it's not going to take very much. Let me tell you that anybody that tells you it takes syringes and syringes of fillers on a patient like this, and even on older patients here, isn't really properly placing it in the right place, and you can get by with a lot less filler. I'll say less filler, maybe not a lot less filler, if you really know where you're placing it and you really know the anatomy and you really know AAFE techniques. And certainly it's really about the live patient training and certification training to do all of these foundational or advanced procedures here. And now we're going to go ahead to smoothing, which is such an important part. I'll let Jill take it away.
So we're all done with Dana's cheeks. We're just giving her a little massage. We're using some arnica gel. This is going to help us really glide over that area. We don't want to flatten the cheeks, certainly. So you can see here, I'm sort of making some contour with my hands. And you just want to make sure that all of the individual boluses that you've placed have sort of just, we're marrying them together with the boluses next to them. So it just feels nice and smooth.
And here are before and afters for the complete treatment, including neurotoxin and dermal fillers here. First of all, to our cheek enhancements, look at those beautiful cheeks and look what it did to our under eye. It eliminated those dark shadows. We did not treat the under eye there. Now look at the profile. Look at how it's raised and given her a snatched jawline, but we didn't even touch the jawline and raise the under chin area for a much better profile view. And the 3/4 view is just gorgeous here, as you can go ahead and see. But all we did was cheek enhancements, pure form injection, lip enhancements, and neurotoxin, and getting this beautiful result, which certainly gave her some significant changes all across her face in this young patient. It's time for you to get AAFE certification trained today and learn these great techniques for your patients and your office.
And by the way, it does a lot more than that. Look at her under eye, by the way. Now, she's got these dark shadows, some tear troughs for that. We didn't touch her tear troughs in this video, obviously. We came back and did them a little later. But just one thing to keep in mind, we teach this all the time. Again, I don't know why we're the only ones that teach this. You never treat tear troughs on their own. You've got to do the cheeks. She just got cheeks in this video, and look how much improvement she got, especially on the entire lateral part of it. Everything is connected. I think that's part of what you've really, that's part of the training that you really have got to go ahead and go through for all of that. Now, let me just show you what can go wrong. And then I want to show you her Botox treatment, just a quick Botox treatment, and why we do Botox and fillers 99% of the time, either together or at different appointments, but they go together pretty much like peanut butter and jelly. For those of you who like peanut butter and jelly, we won't even get into that debate. But post-op complications, what can happen? Bruising can happen. You're poking people in the face that's highly vascularized. Swelling can happen. Infection can happen. Nodules can happen. Vascular occlusion or compression, that's the thing we're most worried about. It's also the rarest of all of the complications if you know what you're doing and if you're well trained. And don't believe me, we see so many complications in the AAFE Med Spa referred by other people. Well, first of all, we have an ultrasound, and also, you know, there's a lot of bad fillers that is done out there. There's a lot of bad Botox that's done out there too. But a vascular occlusion where you block a vessel could be a real problem for patients, you know, most certainly, or even just a compression. Migration, you've got to know how to dissolve filler, use an ultrasound again as you get more advanced for those kinds of things. But those things can really happen. But you've got to learn. At this point in time, there are really so many people who have been poorly trained and so many just bad injectors. You literally could build either a side practice or a whole practice just on dealing with complications and get referrals. And we get a lot of referrals along those lines in the AAFE Med Spa and in the AAFE Training Center. But if you want to see how to go ahead and deal with bad fillers and fix bad fillers fast, we have a program coming up in 2 weeks. So if you want it, it's only $79 till midnight tonight. It's regularly $199, and then it goes up. Go ahead and go to that QR code or go to aafewebinars.com. And this is for if you go ahead and inject fillers already, you've got to know how to dissolve a lip mustache, a wormy tear trough, a huge nightmare bruise, how to go ahead and treat that. Plus, if you use hyaluronidase, which is the dissolving agent for hyaluronic acid fillers, which is most of what we use, do you have an informed consent? You better have an informed consent, and we'll give you that free. Normally, it gets sold for $99 as part of this program, plus a replay for 14 days. If you want it, go to afewebinars.com. There are 200 spots available, and hopefully we'll see you there in 2 weeks for this. But this is a really a limited time offer. Otherwise, I mean, I'm sure the AAFE would be happy if you want to go ahead and pay more. I mean, I'm sure that would make them happy for that, but there's no reason to go ahead and do that. Let's just show you her neurotoxin treatment too. Why do we give I'm not going to go into the whole neurotoxin lecture. If you've never seen a Botox treatment, you will see it. And again, it's only easy. It's a 5-minute treatment if you know the anatomy, physiology, pharmacology, dosaging and all those things. But why do we give these things together? What's it going to do? It's a wrinkle remover. It's a muscle relaxer. It will just, it adds everything. Why do we use it so much with fillers? Because they do 2 different things. First of all, this is really going to control the muscles, smooth out skin. It also controls oral facial pain. But also, once you relax the muscles in the face, the fillers look better and last longer. So those 2 things happen simultaneously, which is why anybody that's coming in for neurotoxin probably is going to get some fillers. People coming in for fillers most likely are going to get some neurotoxin. And that's why when we teach it in the AAFE, our curriculums are level 1 Botox, level 1 fillers. Those pretty much go together. And then level 2, level 3, and all those different kinds of things. So let's go ahead and show you what her neurotoxin, but it's the same thing. Her neurotoxin treatment is going to be based on what? Anatomy, safety, and technique. Same thing. So here we go.
Now we are giving Dana her botulinum toxin treatment after cheek enhancements, after piriform false injection, after lips, and you'll see the total before and after. So we've marked her very carefully here, and this is actually her first botulinum toxin injection. She's never had it before. She's never had any treatment before, and this is quite the first appointment with all of that. So you can see we've mapped out her frontalis. We want an even distribution of botulinum toxin. Let's talk about the technique. ComfortTox syringes, 31 gauge, the sharpest ones on the market for the most comfortable injections here. And we have a predetermined dosaging that we have determined on her, but we want it equally spaced around this frontalis muscle so that the frontalis muscle will become quiet and it will stop contraction in 2 to 10 days and really go ahead and remove, smooth the skin out. The skin's natural state is smooth, and any headache she gets from these muscles will go away completely. And you can see little red bumps that she's going to get. These are all going to go away quickly in the next few minutes. Every little part of the frontalis or skin is different. You can see one a little bit more swollen than the others. All will go away. Now let's go to the procerus muscle in the complex here, in the glabellar complex. These are the glabellar areas, the corrugator muscles, and you can see we are isolating that muscle. Every move we make is strategic here, and we are going in exactly on that muscle. And she's got fairly mid-sized to longer corrugators, so we want to make sure that we get the continual spread along that entire muscle so it starts to calm down. And now the orbicularis oculi, or known as the crow's feet, we really stretch the skin and just glide the ComfortTox syringe right underneath it. We're going to give her a little bit of a brow lift. Here you must know your muscles here and exactly where you want to go. This is an injection for her, not for anybody else, because we want to raise a little bit of that eyebrow just in that area. Other patients want it differently. Now the other crow's feet. And you can go ahead and see, we like to really add traction to the skin. So we will just go ahead right into that area here. These, again, these brow lift, this is a little bit more advanced. I caution you, don't do this if you're not ready for it, because if it gets to the wrong muscles, she won't be able to open her eyes. So you've got to know your anatomy. You've got to know how to deliver this so it stays exactly in the muscle. Same thing with the chin muscle and the mentalis muscle. Very, very particular and precise, because if you get into some of the other muscles, it will look when she smiles like she's had a stroke. Learn how to do this more advanced. Masseter muscle, you've got to isolate it. Make sure you're in the middle of the masseter muscle. Go go straight in and give it as quick as you can give it. And with all those things and with the cheek enhancement she's had, well, here's the botulinum toxin. You can go ahead and see the before and after, and how things are nice and smooth. Got a little raise on the eyebrows as well, and the upper face looks great, but the total face really looks great. Cheek enhancement, piriform injection. Go ahead and take out the lips. We did lips on her. Look at the chin and how the chin has evened out with just a couple of botulinum toxin injections here, and we've smoothed the face totally. We've given it a whole different shape. You can learn to do all of this too. It is time for you to get AAFE certification trained today. Get yourself to a live patient certification course with the AAFE level 1, level 2, level 3, and you can get these kinds of results as well.
All right, so let's go ahead and move on. And again, you can see her from the front, you can see her from the side. She's had more than what you saw, obviously, as we referred to in there, but so much you can do with neurotoxin. You can reshape the face, and certainly you can fill the face with fillers there. So let's go ahead and move on. For that, here is the needle, which I'm sure many of you are thinking, what are they using? It's called the ComfortDoc syringe. It's exclusively distributed by StatDDS.com. It is by far the sharpest needle out there, which is what you want. You want to be known as the most comfortable injector. Many times we will backfill these with filler and go into more precise areas. Specifically, we do that a lot on lips there as well. By far, first of all, it's one of the most reasonable in cost, and right out of the package, it is super sharp. They have something called super sharp technology, multi-bevel sharpness. That's the ComfortDoc. You can see a micrograph on the bottom. The other one is not ComfortDoc, but is a very popular syringe that is used for neurotoxin injections. And by the way, you want something that's got to glide in. This other one, literally, you can feel it drag and tearing tissue as you're going in. As the injector, you have a good tactile sense, so you can really go ahead and feel that as well. So that is the best syringe by far. If you want it, you can go to statdds.com. They have a whole line of products that go with injections, topical anesthetics, all different kind, cannulas. I mean, you name it, and they have it when it comes to injections. These are the only ones we use in AV training, by the way. All right, a lot of training questions. Let me just stop here real quickly, just to grab some questions. Obviously, a lot of training questions. Go to the QR code, go to AAFEwebinars.com or AAFEspecial.com for this. And yeah, it is a great deal. Some of you, congratulations, like 6 or 7 of you already grabbed a package. Yes, you can use them now. You can use them later this year, next year. You can use them whenever you want. I always say, I don't know why. These are valuable skills. Start them now. I mean, literally go ahead and start them now for that. When I use a firm filler versus a flexible filler? That's a very good question. For that, I will use a firm filler if I really want projection. And I need projection. It's not just if I want projection, but I really need projection. I will use a flexible filler in other parts of the face so that, so it kind of moves with the face a little bit more. Now, these flexible fillers, you have to understand, and that's a refine, that's define. It is voluma to a certain extent. It is velour. I mean, you've got different ones. They will typically last longer. They're higher cross link for that. They are also more difficult to dissolve. You got to take all these things into consideration once you really learn the different fillers. But they're all tools in the toolbox. There's no best filler. It's a screwdriver, it's a hammer, it's a wrench. It's just depends on what you are really trying to go ahead and accomplish there for that. And that, again, the workhorses are your Juvederm Ultra, Ultra Plus, your Restylane, your Versa Plus. Those are the workhorses that give you a lot of it. Voluma is great for cheeks and jawlines and a lot of different things for this. Do fillers lift? Fillers do not lift. I'm going to show you the filler that lifts. Well, that's in this program coming up in just a little bit. So here's that webinar special again. If you want it, AAFEspecial.com. For that. Great question. Yeah, you can use fillers all over the body. And Kayla asks, what about the bottom of the feet cushion? She's heard that that's done now. These things are used for a lot of different things. Again, it's a volumizer and it can be a cushion for someone that has got, bone spurs in their feet and that kind of thing. Then you can use it. Typically, you can use a very heavy filler. A Voluma would be the one that you would use around there for that. Yes, podiatrists. We actually train podiatrists depending on the state for that, but they do use a lot of neurotoxin for hyperhidrosis in the feet, of which we have an online certification course for hyperhidrosis, as you can see on the side here. And I mean, and they use fillers for feet cushion there as well. I mean, there's about 300 uses for neurotoxin and a whole bunch of uses for fillers all over the body. So these are things are really really incredible. So if you want these, here you go. I mean, these will be gone by midnight or 12 packages, which may be gone by the end of this webinar. So let's keep going. And yes, you will be ready to inject. And we call our courses, because they are probably one of the only ready to inject courses. You will go back to your office. Everyone says Monday morning, but it could be any morning that you get back to your office, and you can immediately start treating patients for that. I mean, we get that all the time, and we will help you. Again, we're the only ones that have 9 full-time faculty that are there to answer your questions, and all of our faculty are on the AAFE forums where you can ask questions, present cases, get advice for cases, and that kind of stuff. We are not going to train you and leave you. We are actually going to want to make sure that you are really, really successful. So we're really going to push you to get started and get started fast right out of the gate, because we know that's how you're going to be the most successful. So thank you for asking that. Let's talk about lips. And let's go to AAFE lips. I mean, lips is the #1 filler technique. And I mention it all the time. But this is an older patient here. Do you know that 35% of patients now coming into aesthetic practices, whether you're a dentist, physician, you've got your existing practice, but now you added on all the aesthetic things, or you're working in a med spa, or you still want to start a med spa, 35% of all patients coming in right now are Gen Z and millennials, and that's quickly going to Gen Z. They are getting lips when they are 21 years old, when they're 18 years old. I mean, they are getting lips. It is the first usually it's the first thing that they come in for when it comes to injectables, and to them it's like self-care. It's like hair and nails. They have no problem sharing it on social media. It's not like when I first started this 20 years ago in terms of offering this to my patients and getting trained for that, when it was 40-year-olds and older, and they didn't tell anybody that they got any work done, that kind of stuff. Gen Zs, are you kidding? They're on their way to get lips. They're already broadcasting it or making a reel or doing whatever you do on social media for that. And then they'll do it during the procedure and they'll post it after. I mean, it's crazy. I mean, seriously, they get so many lips. So many of the patients that we see in the AAFE Med Spa, I mean, I'm amazed. They're 20 years old, 25 years old. By 25, they've already had lips done 3 times. They've already had neurotoxin. Some of them are getting Sculptra. I mean, it's just unbelievable where we are today, which means for you, these are patients that you're going to have forever, for as long as you're going to be in practice. If they're starting at 20 years old, assuming you're older than 20 years old, which most of you may be, but you may only be 25, and you've got, if you're Gen Z, you've probably gotten some injectables already. So it's really, really incredible. By the way, our trainings are live patient trainings for that. That's the way ideally to really get trained, is live patient training with our faculty here. Let's show you how to do lips with fillers. Here we go. Let me just shut off my camera so you have a better experience. Here we go.
So typically I'll go in, this is her natural kind of Cupid's bow, and we did talk about this a little bit. She's not someone who really wants her Cupid's bow emphasized. She really just likes it more subtle. So I'm not going to go ahead and emphasize that at all. I'm just going to kind of fill the deficit. So little poke. Checking my depth, good depth, and I'm just going to lay a nice linear strut of product. To save her a poke, I'm then gonna fan, so I'm not coming all the way out. Gonna fill this deficit here. I like my depth. I'm always tenting up to make sure that I still do. Nice, healthy strut, excuse me. A little bit of product followed me out, no big deal. Now you can see that this looks a little firm there, a little dimpled, if you will. No big deal. We are going to smooth that out. I do not like to smooth while I'm filling. I like to wait until the end because the patient will swell and then we won't be able to tell what's what. Another thing, you might have just noticed that there was a little bleb of product at the tip of my needle. I see so often injectors wipe with their glove. We don't want to do that. We want to stay sterile. So I didn't want to see that. I just gave it a flick. Or you just go ahead and continue injecting. The filler's going into the body of the lip anyway, so it's no big deal if it's there. Here I am coming a little bit more laterally towards the oral commissure. I feel a little deep there. I'm just going to adjust. Keep in mind, this patient does have lip filler in here already, so we're going to feel a little bit deeper than we might on a patient who doesn't have any lip filler. Good. All right, I'm coming around to the other side. I'm going to have her turn just slightly towards me. And you can see how much more hydrated this side looks. We're just kind of filling in those deficiencies. Work my way up. Good depth. And a nice retrograde injection. That'll keep us safe. And then we're going to fill the body of the lip right here. Good depth. I'm avoiding the wet dry. We don't want to place filler in that wet area because it won't metabolize out. All right, open for me. So we had a little bleeding over here, a little bit of a bruise, no big deal at all. We're going back in. I'm just going to lay a little bit of product closer to the vermilion border just to get this area to pop slightly. Good. And now I'm going to move on to the bottom. So I like to change my needle if possible, if it feels like it's getting dull, just because it does provide a little bit more comfort to the patient. This all looks so beautiful. Now, if you'll notice, this patient has a little bit of this soft tissue swelling above the lip. That's not concerning. Of course, that's going to go down. It starts to look a little shelf-like. This patient actually likes the way that her lips look when they're a little swollen, and we talked about that when she came in. Sometimes when you wake up in the morning or maybe you drink the night before, or you get a little bit of sun, sometimes your lips will end up a little bit swollen, and some people like that look. So that's the goal. We're going to kind of try to get her there with some filler. So I'm moving on to the bottom. I kind of just measure. I'm going to midline, and I'm going to fill this natural tubercle of the lip. Placing a nice, healthy, linear strut of product. And I'm going to do one more a little bit further back. Every patient is different, so my method changes. It's very patient specific. And bear with me, I'm just going to change my needle real quick. It's nice because most fillers these days do come with 2 needles. So if you need to change, you can. I like to do it just for patient comfort, like I said. And then after, I'm going to tell you about what we're going to put on her lips. We do use Comfort Tox post-care lip kit. The patient goes home with it. It is a nice serum and balm. And it has arnica in it, hyaluronic acid, essential oils. It's completely homeopathic. And it's really nice knowing that the patient goes home with something that is clean and patient specific. So you can see here, she has this little bit of a divot right where those 2 tubercles meet. I like to really emphasize that because that's pretty in patients that we can see it in. A little bit of a poke. This patient's doing great. You hanging in there all right? Mm-hmm. This side, I'm going to fan a little bit and just fill this body. Good. I'm going to fill the oral or closer to the oral commissure. Turn towards me, please. Or just slightly. I'm going to fill. You can see here where that filler kind of falls off. You can see it's nice and hydrated and plump, and we just need a little bit more in this corner. Always checking my depth and laying a nice, healthy retrograde injection there. And I'm going to put just slightly more. You doing okay? Mm-hmm. Good. And I'm watching that tissue fill. So often we get the question, how much are you putting? How much are you putting? It's not an exact amount. We don't want to place too much in one area, of course. Turn slightly for me. However, you really want to watch the tissue fill. And that's the goal, right? We're not putting exact amounts in any area. I'm gonna do one more strut and then I'm gonna make sure she kind of stops bleeding so we can take a closer look. This left side is giving me a run for my money. All right. And then go right back so we get some ball. So when I massage, everyone does this a little bit differently, but I like to take a gauze and I always say I like to roll it like a hot dog. I learned that when I was young. This is hamburger way, this is hot dog way. So I wrap it kind of like a hot dog and I'm just giving gentle pressure to kind of feel if I feel any obvious lumps or bumps. And I don't. I'm just kind of manipulating that product just slightly, working out any of those little bumps that I feel, and it feels great. And then down here, so right in the middle where I laid a little bit more product, I do feel a little bit of some firm product that I want to work out slightly, but just you can see just very gentle pressure. Doesn't hurt, correct? Mm-hmm. Good. I'm gonna hold a little bit of pressure there. And this patient is a little swollen, but you know, not terrible at all. They're looking really pretty. All right, so here we are. I have her all cleaned off. We have that one site who's given us a little bit of a problem, but nothing too big of a deal. I'm just gonna put that there for 1 second while I talk to you about this. So this is our Comfort Tox Lips Lip Restore Serum, and you do have to prime it a little bit the first time. So you just keep clicking it and you'll see that little bubble of product appear. So her lips are now nice and clean. I did all the manipulation I wanted to do. And this is not single patient use. It's patient specific. So this is gonna go on now. It's nice and clean, never been used before. If the tip gets a little bloody, we can always alcohol it. This patient knows what to do with it because she's used it before, but watch these lips transform. Look how beautiful they are. So we have a little bit of blood on there. No big deal. I'm gonna clean them off. Put a nice healthy layer of this on. And then I'm going to follow it up with the balm that comes with it. And these lips are just going to look absolutely beautiful. And here we have the balm. I have it on a little applicator. I just put it on the back of my glove to kind of warm it up. And here we go. She does have a little bit of bruising on this right side where I went in a couple times, but nothing too alarming. Of course, she knows to let me know if she has anything concerning whatsoever. And as always, I will see this patient back to make sure everything is looking okay. I think these lips are looking fabulous. Go ahead and close your lips together for me. Perfect. I might have been a little generous with this balm, but it's looking really nice and pretty. I'm just going to use a little bit of a gauze to clean up the sides. Pain-wise, you were okay?
Oh, yeah.
Okay, try to rub your lips together for me. Perfect. I know they feel huge. And there you have it. Thanks for stopping by, guys.
And here is a gorgeous before and after. Sydney is one of our full-time RN faculty in the AAFE and the AAFE Training Center where she sees patients. These are gorgeous lips. Look how small these lips were beforehand. And this took a couple of sessions to go ahead to get them to a really great full lip size that the patient wanted, that the patient absolutely loves. You've got to learn to do this too. It's time for you to get AAFE certification trained today.
Okay, so those are lips, and what you want from lips, by the way, is you want to be a great lip expert. I mean, literally, that's what you want. Here is again another Comfort Docs product. We use this on every single lips. You may have read, or you may have heard, or you may believe, and this may happen to you as well, that, oh my gosh, I'm going to do lips on the patient and they're going to have to hide out for 2 weeks and that kind of stuff. No, people want lips. They want them now. They want to look great now. You want to minimize the swelling. There's lots of techniques to do that. It's exactly what we go ahead and teach. Plus, go ahead and use something like this. This is an incredible, incredible product that just goes ahead and controls that swelling, controls the bruising. It takes it away after a day or so. There are many times you are going to get some swelling or bruising for that, but you can really reduce it with technique, anatomy, safety, and also a product like this. It is fantastic. We use it after every single lip case that we do. We teach it in our courses there as well. So ComfortDox Lips is what it's called. I think it costs like $30 for your office. I mean, you just include it in the price of your lips. I know whatever you charge for lips, just raise that by $30, and then there's not even a discussion for the patient if they want it. They love it, by the way. They go home, the serum balm. Some of them just like it so much that they use it occasionally, or they always have some with them and that kind of thing. I mean, really, I could show you literally thousands of lips before and afters. These are the kinds of lips that are done at our courses. This was a lip case that was done at an AAFE course. That's pretty incredible. I mean, really, that's really pretty incredible for that. For that patient, probably was either a Juvederm Ultra or a Versa Lips for that patient that was used for her lips. Those are two of our favorites. But again, they use a lot of different lip fillers for that. What can go wrong? This is what happens when you go ahead and overfill lips. And this happens so often for people who are poorly trained. I got to tell you, we spend a lot of time every week dissolving the lip mustache. It's something that's called the lip mustache. What happens? People try to put too much filler in the lips. The lips can't hold them, so it diffuses into the surrounding tissue, and you get this lip mustache. So this, again, I mentioned it before, this is exactly what we're going to go ahead and talk about. One of the things that we talk about when we talk about fixing bad fillers is in this thing in a couple of weeks, in this webinar, this training webinar. This is a real training webinar that's going to show you exactly how to fix bad fillers fast and dissolve lip mustache, wormy tear trough, and reverse a huge nightmare bruise that you're going to see, plus a whole lot more. So again, $79 till midnight, then it goes up. So if you want it, get it. Otherwise, you're welcome to pay more. It includes a hyaluronidase informed consent, and it's got a replay for 14 days, so you can review it many, many times for that. These are exactly the cases that you'll see. And again, a whole lot more. QR code or AAFEwebinars.com will take you there as well. Let's go to a third filler that we use that is called a solid filler, and this is a regenerative filler. This is going to build collagen and elastin, and is called a solid filler smooth PDO thread. We're going to show you a solid filler that lifts the face, and that's going to be a lifting PDO thread. Incredible cases coming up for that, and then we're going to talk about financial impact to the practice, et cetera, and those kinds of things there too. But let's show you this. This is going to be a little bit different than the dermal filler, which is the jellies. This is going to be a solid filler that's going to build collagen, and that is exactly what you're seeing on the screen. This comes in a hypodermic needle, obviously all sterile, and it is a PDO thread. What's PDO? Polydioxanone thread. It's really a suture material that's been around for 60 years and been used. It's a very slowly absorbable suture material. Takes about 4 to 6 weeks to totally absorb, but when you put it into the right plane, which is going to be the subdermal plane, in the tissue here, as it starts to break down in this micrograph, you can see the cross section. Those semi-round things are the smooth PDO threads. What's on top of it? All brand new collagen and elastin, which the body goes ahead and regenerates as these suture materials go ahead and start to break down. We're not using it to suture, but we are using it to stimulate collagen and elastin through something called neocollagenesis. And again, I'm just going to show you how to go and put them in. They're really easy to put in. Now, you've seen crazy stuff on social media, that's for sure. Now, the left is a joke that's called needle art. The right, though, that's real, someone using smooth PDO threads. And I will tell you that is absolutely the wrong way to use smooth PDO threads for that. If you need this many smooth PDO threads, you are using the wrong PDO thread that doesn't build a lot of collagen. They're not all made the same. Different polydioxanones, some are much better, some don't do hardly anything, which is why this person needed so many of these threads. That's absurd. My opinion, I'm entitled to it, but that is just crazy to use that many smooth PO threads on a patient. What you want to do with threads, whether it's smooth or lifting, is you want the maximum effect for the least amount of threads, not the maximum amount of threads for the least amount of effect. I mean, that's at least for us. I want these should be minimally invasive, non-surgical, give you the best result, but they are great collagen biostimulators when you use the right one. The one that we use is called V-Soft Lift. That's the name of the company. These are the 3 top selling in the United States. The V-Soft Lift, Nova Threads, and Mint PDO. But here's an equivalency chart. What I mean by that is for every 1 V-Soft Lift thread you need, whether it's lifting or smooth, you need 3 to 4 of Nova Threads, 4 to 5 of Mint PDO. Mint PDO actually took their smooth PDO threads off the market. I guess I'm not going to say why. Maybe you can guess why. But you know, if things were working out, people don't take things off of the market there. So I'm not, I'll leave it to them to answer that question. But why would you use 4 to 5 threads or 3 to 4 threads when you can use 1 thread and get the same or a better effect? This is going to be true of lifting PDO threads. So I just want to show you what this looks like. This actually, once you've been trained and get started with neurotoxin, Botox, and fillers for sure as you get started with that. After that, smooth PDO threads should come very simple, very quickly. Why? Probably the easiest injectable to place once you learn how to place it in the right plane. We could put these things in all day. They are easy, they are fun, they are quick, and they do an absolutely fantastic job. The difference between this and the dermal filler you put in now, you put it in to 100% correction. What you see is what you get. Then it lasts about 6 months, some last longer, and then it starts to go away. These get better over time. You're building the patient's own collagen and elastin. So let me show you what I mean by that. So here's a training video, and here we go.
We love placing smooth PDO threads, and you're going to see why. We're going to use them as a solid filler here because this patient is a younger patient and has lost some volume or naturally didn't have it. We're going to replace it with solid filler, smooth PDO threads. These are going to be the V-Soft Lift brand of threads here. So the patient's been cleaned up. The patient has had some topical anesthetic, the Comfortox BLT, for about 10 minutes on there. And so you can see this is going to be a fairly comfortable procedure for this patient. We are using, like I said, V-Soft Lift 29 gauge by 30, 29 gauge by 40 smooth threads, or you can use 29 gauge by 40 twisted threads for even more. So let's talk about the technique a little bit and what we are doing here. So you can go ahead and see these PDO threads come in a sharp needle, pulling back on the skin to retract it, stabilize a little bit, going into what's called the subdermal plane. And when you go into the subdermal plane, they will go in very, very easily and very, very nicely there. And you'll just know it'll kind of glide in. If you are too superficial, it will go ahead and be very hard to get it in. You'll feel a lot of resistance, and the patient will feel a lot of pain because you will be in the epidermal layer or close to it. And if it just sinks right in, then you are too deep in the subcutaneous fat area. And once you get them to place, 360 turn, hold down that area before you take it out, and you take them right out. You can see get a little bit of bleeding. Now, in that area, in that one nasolabial fold, all you saw were 4 V-Soft Lift PDO threads. If you were using any other brand of PDO thread, and that would be 4 to 5 times the number of threads you would use. Why? Because these PDO threads, the V-Soft Lift brand, produce the most collagen by far over any other PDO thread on the market there. And you see some of these crazy cases that people use for clickbait on Instagram and Facebook, where they put literally 10, 20, 30 threads in that little area or in one area. It's just amazing that anybody would tolerate that. But you as the clinician need to use the best tool to get maximum efficiency, maximum collagen building with the least amount of treatment. And that's why we're using this with AAFE techniques. We can, when you take AAFE certification training, live patient certification training on smooth PDO threads, we'll show you exactly what patterns, exactly how to go for this. Now, what's happening here? Now that you know the technique, what are we leaving behind? We are leaving behind an absorbable suture material, that's polydioxanone, known as PDO thread, used for 50 years in cardiac, brain, dental surgery, and it's a slow absorbable suture. And that slow absorbable suture is going to be left behind. And from an aesthetic point of view, what the body's natural reaction as it slowly goes ahead and breaks down is what? Building its own natural collagen. That's going to stay for 2-3 years, depending on the patient here. Now we are going to go ahead and do some nasolabial folds. You can place one at a time, you can place all of them, and then take them out at a time for this. What's the advantage of this over dermal fillers? The advantage is there's no jelly filler, so you are never going to cannulate an artery. You're never going to have a vascular occlusion or a vascular compression, because imagine if you had a dermal filler and you just had it in a solid, thin piece that you could precisely place anywhere and then grows collagen over time. It's a great collagen biostimulator. That's exactly what you've got with solid filler smooth PDO threads, and they're by the name solid filler because that's exactly what they are. So now let's talk about the different areas. Going into the nasolabial fold, just follow the fold up. And again, the subdermal plane, which is going to be a little bit below the dermis, right below the dermis. And that is the most comfortable plane, the easiest plane to get them into, but that gives you the greatest amount of collagen building. By the way, it's not just collagen that you're building. You are building collagen. The body's building its own natural collagen and elastin. And that is what gives the skin really some great texture there as well. Now you can see, just following up the nasolabial fold from a few different angles there to place the solid filler and eventually place the collagen exactly where you want it. And in a patient like this, that is young, that has started to develop nasolabial folds, they don't need many PDO threads, as you can see, if you're using the right kind of PDO thread, number one, and then in a month, and then we repeat this about once a month for 3 months, depending on the patient. Sometimes they only need one treatment. Some patients need more than one treatment, and that would be about 4 to 6 weeks apart till they get good collagen building. This patient actually only needed a couple of treatments here, and you'll see the result in the before and after very soon. But you'll see just it grows its own natural collagen. So you never look overdone. You never look bloated, as sometimes people look with dermal fillers because of all the water attraction, or sometimes people overtreat with dermal fillers. You won't get that here. And so dermal fillers are great. Just know what tool is best from your toolbox for the clinical situation that you're doing. But the V-Self Lift brand, because they have a special polymer coating that no other brand has, they are the best, and they more slowly break down, give more collagen building, and that's what you want. That's what your patients want, with the least amount of threads and the maximum result that is going to last 1 to 2 and possibly even longer, depending on the patient's metabolism here. And you can see we did both sides, nasolabial folds, marionette lines, oral commissures a little bit. And here's the great result that you can see. Look at the before, where she started to develop those folds, and look at the after. Beautiful natural collagen. You can learn to do this too, and you should add this to your practice for sure, especially if you already use Botox and dermal fillers. And it's time for you to get AAFE certification trained today. That's the way to properly learn this, so you can deliver this to your patient.
Okay, and let me show you what else smooth PO threads can do, because it's again, you're not going to get that. You're going to get an immediate visible result with some structure, but you're not going to get the cheek that happens there. But here's what else it does that the other dermal fillers, hyaluronic acid fillers, don't do. This kind of patient that wants to go ahead and get some cheeks, and she had very flat cheeks here, as you can see, and now she's got this really nice sculpted cheek on here. This is a 21-year-old patient that's been around to every single, Derm and Med Spa, and had all kinds of topical treatments that really weren't taking care of all of these acne scars that she's had. She had two treatments of smooth PDO threads. And because you can't just treat acne scars topically, you've got to go ahead and build a foundation of collagen underneath it there. So you've got to build this from the inside out to have any kind of topical treatment, whether it's lasers or IPLs or microneedling or anything else, a chance to do that. This is 2 months' time, which is amazing. She spent a few years going from place to place to place to try to get this treated here, and 2 sessions of smooth PO threads. This does not happen with dermal fillers, hyaluronic acid dermal fillers. They are only about volume. This is regenerative, and this can really fix a lot of problems. One simple example, I mean, I can show you dozens of things that smooth PO threads do, including lip borders, like on this patient. And this patient has had everything imaginable, from neurotoxin to dermal fillers to smooth PO threads, and even lifting PO threads and cheek filler and lips and everything else, as you can see the transformation for there too. So again, it's not just about solid filler, smooth PO threads. It's not just about dermal fillers. It's not just about toxin. It's about all of the things together, depending on what the patient wants. What are what's the ROI for smooth PO threads? Quite substantial. Again, it only takes minutes to go ahead and deliver once you're well trained and you know the right plane to put these things in on for that. But this kind of patient, here's her stats for what we used. We used 20 V-Soft Lift Smooth PO threads, 10 on each side of her face, not 20 or 30 or 50 on each side of her face, like what you see in some of these crazy, crazy others that go ahead and do this with inferior products. Your cost of the product is $100. Patient fee per treatment, anywhere from $650 to $850. Certainly you can charge more if you want. Treatment time is literally 5 minutes. They go in and come out pretty easily. Number of treatments, 1 to 3, about 4 to 6 weeks apart. Results lasting 12 to 24 months. Why don't results last longer? This is the patient's own collagen, because that's how long collagen lasts in a patient of this age. If she was younger, it would last longer. If she's older, it's going to last a little bit less. It just really depends on the patient. It's the patient's own collagen. And if we didn't age, it would stay forever. But unfortunately, or maybe fortunately for us, people are not going to stop aging for all of that here. Now, how can you get trained? A bunch of you are asking. So first of all, if you grab one of those packages I mentioned before, you can add on for just $199 this entire training, or you can just do this training if you're interested. AAFEvirtual.com. This is the AAFE has the only live virtual CME certification. This is an 8-hour CME certification training on smooth PO threads, and you don't have to leave your home or your office. It's the only one of its kind. This course includes a box of smooth PO threads. When you get it with those packages, it doesn't include this box of smooth PO threads. $500 off for the next 24 hours, only $997 for non-AAFE members. AAFE members are going to save even more for this. But this is a full, and there is a live virtual Q&A session every month. And again, you can go to the AAFE membership site and get help there as well. Yes, you can use it for wrinkly, saggy necks. It permanently removes fat from underneath the chin for there. We use it on necks all the time because as it produces collagen, it's going to go ahead and tighten the skin on the face, on the neck, in the jawline for that. It is amazing. These are absolutely amazing for that. And like I said, it's the easiest. Once you get it, it's the easiest of all the fillers together. Let's go ahead and show you one more filler, and this is going to be a smooth, solid filler lifting PDO thread. But again, people are not aging, and this is why people want neurotoxin, why they want fillers, why they want so many other things for that, because nobody in Hollywood, and no one that you're seeing on the big screen or the small screen, I guess, today is aging at all. They're actually looking better than they looked when they were younger, which is really amazing. Let's show you lifting PDO threads for that. This is always our favorite case to show because she first came in for lifting PO threads, not for Botox, not for fillers, not for anything else. She read about lifting PO threads. She hated all the sagging on her lower face, which nobody really likes. And that's her purely with just V-Soft Lift lifting PO threads and AAFE techniques. I want to show you a great case for this. Again, just to show you the difference, smooth PO threads were smooth. They're a collagen biostimulator. Lifting PO threads have got these barbs or hooks on them that is going to give a physical lift to the face. They are also polydioxanone. They are PDO. Again, these are suture materials, and these are sutures that self-ligate when you go ahead and kind of twist them around, and they are used in cardiac surgery and brain surgery and a lot of dental surgery. We've used all of them for many, many years. Yeah, our training for this is in-person live patient training. It's the only way to learn lifting PO threads. Smooth PO threads you can learn with an online certification course. With that smooth PO thread course that I was talking about, there's actually a module in that course that will show you how to do a hands-on on a chicken breast or on a skin pad. They'll tell you exactly what to get from Amazon or whatever, and it's about getting in the right plane. This, though, is a live patient training course. Only way to really go ahead and do that. There are two kinds. There's a barbed, which is the top thread here. The three bottom ones are called molded threads. V-Soft Lift, in our testing, in our opinion, is about, these threads are about 25% stronger of any of the other threads on the market, which is why we only need one thread for each 4 to 5 of their threads for that. And again, I'll show you what I mean by that. And we'll show you where to get training in just a little bit. So we'll show you that too. There's the equivalency chart. Again, for every one V-Soft Lift, you're going to need 4 to 5 of Mint PDO, 3 to 4 of Nova threads. I'll show you what I mean by that. That's not me talking. That is the other companies talking, and I'll show you what I mean by that. This is a very typical V-Soft Lift lifting thread case. 4 threads on each side of the face. I'm actually going to show you some of her case, just so you really get a good feel for what this looks like. This is either a Mint or a Nova Threads case for that. You count how many threads are in each side of the face. I mean, go ahead and count it. Now, for this, they will tell you, I've taken their training. Some of you have taken their trainings and have been very frustrated. I mean, they will sedate the patient. They will afterwards give them narcotics, antibiotics, and steroids for that. I mean, it's not that far off from a surgical case. Now, if you're using 20 lifting PDO threads on each side of the face, your cost just for the lifting PDO threads is going to be a few $1,000s, which means you're going to go ahead and charge the patient what? $7,000, $8,000. It's a nice result afterwards, but do you really need that many? Well, you'll decide. You'll see this patient's case. 4 on one side or 20. What would you have if you were the patient? You're pretty much probably all scaredy cats for that. But I tell you, your patients are going to want the maximum effect for the least amount of threads. It's also going to be very cost effective for them. So let's show you some of a case so you really get a good feel for, for what this is for that. It's really incredible. This is the only lifting filler. You cannot lift with a jelly hyaluronic acid filler. So here we go.
In this training video, we want to focus in on a few things here. We're going to follow pretty much the regular AAFE protocol. The few things we are going to go ahead and do differently. Here we are going ahead and just giving some anesthesia right at the injection points at the pilot hole and at the end of where the threads are going to end up. And in this one, we are going to use a molded thread. This is going to be a 19 gauge by 100 millimeter molded thread, and that's going to give us a little bit more strength. And you're going to see a couple of things that are going to be a little bit different here. But pilot hole, 18 gauge pilot hole, we're going to go ahead and do that. Remember, when you're doing this, this already will set you into the right plane. So this is really crucial. And you see with the 3 vectors that we're doing here, we are going along all 3 vectors and going side to side to open up those that area there. And now we are going to go ahead and take a microcannula with lidocaine and pre-tunnel this area. And as we're going to go ahead and see, we're going to use the non-dominant hand and just keep going curtain over the curtain rod, and it's going to go through just fine. And retrograde injection of some some local anesthetic here. Lidocaine, 2% will do the job just fine, and we don't really need epinephrine because we don't need any long working anesthetic here at all. We're just going to go along all three tunnels. The important part of this is to be in the right plane, because this will send your thread into the right plane already here. But I want you to notice the pattern that we're doing, and let's have a discussion about going ahead. And as you see in the nasolabial fold, we're going to go past the nasolabial fold. We're going to go past the marionette line. We're going to go all the way down to the jowl, all three here in doing these tunnels. And when we place these threads, the reason in this case we are going past the nasolabial fold, we don't always, is because the patient has a fairly flat cheek. When there's a flat cheek like that, it's easy to get past this area, and you're going to see that right now. Now, this is a molded thread with an L-shaped tip, and you can see we're going to punch through the ligament right there. You can do that with a sharp tip. You can do that with an L-shaped tip. And as we go past the nasolabial fold, and you don't have to go to the hub of the molded thread, or any thread for that matter. You don't have to go to the hub. You just have to get to where you want to end up here. So flat cheeks, that's when you can go past the nasolabial fold. When the cheek has a curve, it makes it very difficult to get all the way to the nasolabial fold, and you don't necessarily need that in many cases there as well. Whether it's a molded or whether it's a barbed thread, it doesn't really matter. Now we're going to go ahead along that second vector here, as you can go ahead and see, and we're going to go pinch that in and really go ahead and give a little push there, but use the other hand to pull the tissue up over the cannula, but also punch it through those ligaments. As you can see, that's the areas when you come up to an area that you need a little bit more of a tug. That is when you can go ahead and do this. Now, the L-shaped cannula in these molded threads here are, imagine you took a blunt cannula and you only shaved off horizontally half of the blunt, so you have kind of like a flat end. That is called an L-shaped tip, and we cover that in the AAFE training course. So you can go ahead and review the different tips. There's sharp, there's full blunt, and then L-shaped here. L-shaped really does the job quite nicely, just like a sharp, to go through the ligaments here, but you're not worried about coming out the other end of the tissue here. As you can see the how it was poking through the tissue, but wasn't coming out the other end here. The molded threads come with an L-shaped tip here, and you can see we got all three in fairly well. And again, one went to the hub, the other didn't necessarily go to the hub. Now, I want you to go ahead and see the pull that you're going to get and appreciate from the beginning and what you'll see at the end. And even now you can see the view of that jawline, how it's really a little bit diffuse and not very sharp. But you're going to see between the lifting threads of 3 vectors and now the 1 vector along the jawline, you're going to go ahead and see just a beautiful, sharply defined jawline and a little bit more cheek as you pull everything up and really lessen the jowls on this patient here. Same thing here. We're just going to go ahead and use a microcannula, deliver some local anesthetic in this area with the retrograde injection once we get by all the way to the end to where we want to get to on that. And sometimes it takes a little bit of work to go ahead and do that. So make sure that you can go ahead and feel where the end of that tip is and give that a nice nice string of lidocaine as you go ahead and pull out. That's the pre-tunnel. Now we're going to go ahead. You can kind of see the flat end right there as it goes into the tissue here. Takes a little bit of a push, a little bit of a twist to go in there. Use your non-dominant hand, curtain over the curtain rod. Feel where the end of that tip is and just get it to place as far as you can like it. Every time there's that extra little push, that is going through the ligament and mandibular ligament in this case. Again, doesn't have to go down to the hub. That did the trick. And now you go ahead and pull right back. And now we can go ahead and really go ahead and give this a reverse pull to make it really nice and tight, and get a scissors to go ahead and snip off the ends of all 3 of these. It doesn't take very long. Your first couple of cases, especially in training, then we want you to really take your time and really do the job here very nicely. But once you get good at this is a total of a 7-minute video, 4 threads, get it in there fairly quickly from start to finish. This is a procedure that you are here to learn and all to do. But appreciate the fact that when do we go past the nasolabial fold? When don't we? When we do it in the nasolabial fold and you can get around the cheek because the patient's got flat cheeks, then it's worthwhile getting as much grab as you can if that's what you need. Why molded thread? Molded thread is going to be stronger than a barbed thread if you really want more of a pull. But now appreciate and look how beautiful that jawline is. We're going to get the patient all cleaned up. You can really see a much sharper jawline. Jowls going, jowls are just gone here. Beautiful, beautiful result. And as you know, just get them cleaned up, put a couple Band-Aids on, give them post-op instructions. But there you see molded thread in use. There you see a different pattern of when we go past the nasolabial fold and marionette lines. And all of this is something that you should be doing with some experience and great training by the AAFE. And here is an absolutely amazing transformation before and after here. Take a look at that jawline. Take a look at the nasolabial fold and at the oral commissure and also the marionette line. It looks like a different person, and that is really what you're trying to accomplish. Everything is nice and tight, snatched jawline, lifted cheek as part of this there as well. So many advantages when you learn how to use the right AAFE techniques, the right PDO thread that is the strongest with the least amount of threads. That's the way to do it. It's time for you to get AAFE certification. Train today.
That's an incredible case. That really is an incredible case here. And let's go ahead and show you what's the benefit to your practice. And again, it's got a higher ROI than Botox and fillers because the time involvement and the again, it's a low cost for the actual threads. The patient fees are very, very healthy, as you can go ahead and see. So what do we do? Look at this patient. That's an incredible result. You cannot do this with neurotoxin. You cannot do this with hyaluronic acid fillers. They all have their different place for that. You can't do this with smooth PO threads. You need a physical lift. And this took 3 V-Soft lift threads on each side of the face, 6 total. Your cost $210. Patient fee anywhere from $1,750 to $2,500. You can charge less. You can certainly charge more. Treatment time is 20 minutes. Once you're well trained, anatomy, safety, and technique. Number of treatments, 1. Results lasting 12 to 24 months generally for all of that. 2 ways to get trained on lifting PDO threads, which a lot of you are thinking about here. You can either go to afetraining.com. Number 1, you can do actually 3 ways. As part of this program, afespecial.com, and it can be one of the courses that is in your course package that you go ahead and include. This also, the lifting PO thread course also trains you in smooth PO thread, so you get the entire package. Or the other way is you can go to vsoftlift.us, and they have PDO thread packages. Either way here, you're going to get AAFE training, the comprehensive training with the AAFE and in-person training. But if they have different PDO thread packages. If you buy a big enough package, you get to come to an AAFE course and a group training course for that. If you buy a big enough package, even bigger, I guess, they'll fly an AAFE trainer out to your office. You'll get the full AAFE training, but you will be treating your patients in your office for a few hours with an AAFE trainer. And they are, again, they're the best that are out there for this. And you will get these kinds of results. And I can show you literally dozens and dozens of hundreds at this point, because we have so many AAFE members that are trained in this for that. This is an incredible result. She is an older woman. There's no question. She has taken very good care of herself, including skincare and that kind of thing. But you can't get this just with skincare. This is neurotoxin, fillers, smooth PO threads, lifting PO threads. She's had it all for that. And then we'll love to show this patient just because she's an AAFE member and she's an NP, and she, got fully trained and does all this in her med spas and that, and then looked in the mirror and said, you know what? I got to walk the walk. I can't just talk the talk for all that. Lifting PO threads first. You've got to learn about treatment progression. Lifting PO threads first. Then you get neurotoxin at any time. Then you go with fillers, smooth PO threads, and you start to build it out. And she looks really good. This is good. Now, could she go get a facelift? Yes, she can go get a facelift. We recommend people go for facelifts all the time. And they would rather not spend that kind of money. They don't want necessarily surgery. Some go for it for sure. We refer people to plastic surgeons all the time for facelifts. We get referrals back from the plastic surgeon because if they've had a facelift, it's not an end all or be all, right? People still age after a facelift and they don't want another facelift for that. You throw through a few threads in there, tighten things up a year after a facelift, they're as good as new. And there are a lot of plastic surgeons that go ahead and do lifting pedo threads. We know because we've trained a bunch, or they'll just refer it to AAFE members for that. So it's good to have a good relationship with plastic surgeons. That's for facial plastic surgeons, especially for that. But I mean, I can go on and I can show you many before and afters, but it's not just about fillers. It's not just about neurotoxin. It's really about those four things. Don't have to learn them all at once, by the way. Start off with a level 1 Botox and fillers, level 2 Botox and fillers. Again, keep building your skills and building them up. Add smooth PDO threads, add solid filler lifting PDO threads for all of that, and you will be a very well-rounded, sought-after injector for that. And again, the AAFE can take you. And again, just to show you again, you know, they're looking better as older they get. And if you think that none of them are getting treatments, you would be wrong. I don't know exactly what treatments these people are getting, but certainly they're getting some treatments. And here's one of our patients for there. Now, I love showing her too, because you know, it's not just it's really about you know, people will refer like crazy there as well for that. She actually runs all the, you know, there's a Nordstrom about 1.5 miles from us, and she runs the entire cosmetics floor. Like she's like the manager of the entire floor, you know, all those different brands of cosmetics for that. So she's working with all these different cosmetic companies, all these different tables, and you know how they have it set up at Nordstrom's. And like, you know, I mean, what do we do on her? Lift first. Neurotoxin filler, neurotoxin anytime. Fillers after that lift has settled in for a couple of weeks. There are smooth PO threads for collagen biostimulation, tear troughs, and that kind of thing for that. Hair she does on her own. I love the either carpool or in the car selfies because that natural sunlight, they look fantastic. The lighting is always good for all of that. And people have said, can't believe that's the same person. That's the same person. It's amazing what we can do when you're well trained, anatomy, safety, and technique, all these things. Now, bottom line in terms of, I'll just give you, because we run this probably every about once a year with thousands of AAFE members, and the question basically is, I mean, it's a pretty good questionnaire for this, but the question basically is, a year after you've been trained in level 1 Botox and fillers, and again, you know, what other courses they may have taken after that, here's an average increase for someone who's got a practice already, and they're adding on Botox and dermal fillers. The average increase for them, let's say this is a dental office or a medical office existing already, has been of $32,500 of production per month in only injectables. That's incredible for that. That's in addition to everything else they're doing. Some are doing less, obviously. This is why this is an average. Some are doing much more. I mean, much more, $50,000, $60,000 a month. That's how popular these are. Now, if you have a med spa or you want to start a med spa, with the expectation is that's where the bulk of what you're doing is coming from, and it's going to be, you know, on the $50,000, $60,000 a month easily, building up after that. Those who do Botox fillers and PDO threads are in the $65,000 to $70,000 a month on average. Again, some are doing more, some are doing less. So that's again why it's an average. But it's really the effort that you put in, the journey that you are willing to take. But you've been trained as a physician, as a dentist, as a nurse practitioner, PA. You've gotten to where you are in life by being well trained and then getting, you know, going and working wherever you're working and getting more training for that. That's exactly what this is. You've already proven to yourself that you can do it. You can certainly do aesthetics, and it's the most fun you're ever going to have in medicine, dentistry, or nursing, or anything else. So let me take some questions for that. Let me just go through some of these because this will answer some of your questions. Cadaver course, I mentioned before, go to afecadaverlab.com or afetraining.com. It's $1,000 off for a limited time. Those are the upcoming sessions that we have coming up. So you see we have them around the country. Here is this again, which a bunch of you asking for. A bunch of you signed up. Can't wait to see you in 2 weeks for this training here. New ways to fix bad fillers fast. Dissolve lip mustache, wormy tear draw, reverse huge nightmare bruise. If you're already doing fillers, you need to take this. It is deeply discounted till midnight tonight, then it goes up. You're going to get a hyaluronidase informed consent, which if you don't have, you absolutely need before you inject hyaluronidase, the dissolving agent for fillers, before you touch a patient for that. And we'll certainly talk about why that is so. So go to afewebinars.com or go direct to that QR code, and that'll take you right to the reservation page and lock this in. Or again, pay more as it goes up for that. But it's going to be a great session for this. And I'll talk about bruising and how to get rid of nightmare bruises and that kind of thing as well. Please follow the AAFE on all the social media channels. avspecial.com. We mentioned before this is just some of our certification courses. We have most of them are live patient. We have online certification in different topics. You'll see it all at avspecial.com. And the best faculty in the world. I'm telling you, I love each and every one of these people. I am really privileged to work with them because they are the greatest people in the world, and they're real injectors, just like all of you. They have very successful medical, dental, nursing, med spa practices. They can talk to you about all kinds of things. There's emergency medicine in here. There's, I don't even know. There's functional medicine that also has aesthetics in their practice. There's laser. You've got every kind of dentist that is in here, from a general dentist to an endodontist, a periodontist, dental hygienist. You've got PAs. You've got nurse practitioners that previously specialized in different things. It's incredible, and they are really a great. I'm so proud of all of them because they really represent the AAFE really well. You'll see me a lot in the on-demand training that comes with it. So this is, again, locations around the country. Don't worry about locations. You'll get the location you want. Just lock in these packages right now, afespecial.com till midnight tonight. Gold package has got 4 courses. Silver Plus has got 3. Silver course package has got 2. And again, they includes injectable products to use at the course and all different benefits. Plus, you can add on these online certification course and save hundreds of dollars for that. $199 for one, $299 for 2. It's just incredible. Whether you want PRP, PRF, ultrasound complications, frontline TMJ level 2, hyperhidrosis, excessive sweating, smooth PO threads. So any of these things that you want. They've never run an over 30% off sale before. So if you want to lock it in now is the time. Let me get some questions in, and then we will wrap up here. Let me get to the questions. We've got this for questions. We've got that for questions. Wait, I'm not sure what happened there. I'll leave that up because a lot of you, all your training questions are going to go right here. Does the class on July 8th give certifications at the end? You'd have to contact the AAFE for that. Let's take a look. Not sure what this is. Let's take a look. No, Radius I would not use for lip filler. It is not a lip filler. It's a calcium hydroxylapatite white material. White fillers do not belong in lips. For that, let's see what we've got over here. Is AV training for metafacials? We have private trainings for metafacials. For that, smooth PDO threads under tear troughs. Absolutely. We do it all the time. And it's a great use of smooth PO threads because you're not worried about a lot of things. We use fillers, dermal fillers for tear troughs here as well. You got to worry about a lot of things. We just gave a session on that on tear troughs, I think last week for that, and that'll come around again. We have an online session that you can purchase for tear troughs that includes PDO threads for that as well. I mean, we train almost everything that's got to do with the head, face, and neck when it comes to aesthetics and for therapeutics. And I think that's really about it. All your other training questions for that, you'll start right away. As soon as you get started, the AAFE will get in touch with you. Choose whatever courses that you want. The on-demand courses, whatever, you'll get access to them right away. Go at your own speed. When you come to the live patient training, you'll have done all your didactic already, so you can really concentrate on live patient training for that. And again, we have the best trainers that are out there. They are really, really remarkable trainers for that. Let's take a look. For the virtual certification for smooth PDO threads, there is a module that will take you through, an on-demand module that will take you through exactly how to place them, tell you what to get to practice on. For when you buy that aafevirtual.com, that comes with a box of smooth threads with it, and it'll literally take you step by step for that. Then in addition to that, we have a live monthly session for Q&A, and again, to talk out any issues, if you want to show cases or anything else like that for that. Good question, Rick. What treatments do you see men getting for that? Men are getting just about everything now. Now, it's still primarily women. I think that may always be the case. Men is certainly growing quite a bit. Men are getting a lot of fillers because they want the volume like everything else. A ton of neurotoxin for that. They are getting regenerative fillers as well. They are getting hair restoration, which I didn't cover in this course for that. They're getting hyperhidrosis, excessive sweating treatment with neurotoxin, hyperhidrosis. And again, we have an online certification. I think it's one of the choices here. It is, and worthwhile to add on. I mean, they don't sweat underarms for 6 months. That's heaven for many, many patients, whether it's a woman, whether it's a man. Now's the time of the year when we do the most hyperhidrosis treatment for that. And it's a lot of neurotoxin, and it's very profitable, and it doesn't take very long for that. So men are getting the whole shebang when it comes to that, but different. You've got to learn how to do neurotoxin a little bit differently. Placing filler on a man so it's a little bit more of a masculine look is going to be a little bit differently. Snatching back their jawline with lifting PO threads, a lot of that. What man doesn't want that very sharp jawline to look younger and just have that, great profile for all of that. So we're seeing men get a lot of these different treatments for that. In addition to, in our PRP PRF course, which also is an online certification, that's hair restoration and hair growth with PRP and smooth PO threads, by the way. We use it for that. So that's a great question for all of that. So thank you to all of you for being on here and sticking around with us for all of this. Hope to see you at a live patient training course. Again, let me show you this final slide here again. So here you've got everything. There's my email. There's the AAFE's email, aafespecial.com. I think there might be one or two of these packages left. Grab them if you want for that. aafevirtual.com, the smooth PDO thread training, statds.com, all the ComfortTox products that we mentioned and more. Vsoft threads, vsoftlift.us for the training deals. That is smooth and lifting PDO threads. Perfect PRF, that's our PRP, PRF online certification program. Waveaesthetics.com if you're looking for the best ultrasound, facial ultrasound for facial aesthetics, optimized for facial aesthetics. Thousands of dollars less than anything else on the market, and will do the job as well, if not better, than waveaesthetics.com, and as always, aafewebinars.com. Final couple of questions for that. How can you get certified in your state, Virginia? We give courses in Virginia all the time to dentists, physicians, just about everybody else. Everybody knows our AV training, for dentists, physicians, nurses, nurse practitioners in Virginia, and we're there fairly often for that. Dental hygienist just depends on the state for that. I don't think Virginia is there yet for dental hygienists. There are about almost 10 states already that dental hygienists are doing it, and that is growing for that. So thank you all for being on. Continued success to all of you. We hope to see you at an AAFE live patient training, on-demand training, another one of these webinar sessions. So you take care, everybody. Great to see you. Continued success. We will talk to you all again.